Welcome to American Dragon Presents Chinese Medicine in America. My name is Joel Pinner. I'm a doctor of Oriental medicine, an acupuncturist, and a Chinese herbalist. I'm also co-author of the textbook Zong Fu Syndromes, Differential Diagnosis and Treatment. In this episode, we will examine the pathologies associated with yin and yang and the vital substance qi. In the last episode, I mentioned that yin and yang are not diagnostically relevant in association with the 8 principles. In this episode, however, we will look at yin and yang in their roles as substantive factors. In other words, in the body, yin and yang are associated with physical substances, primarily heat and energy in the case of yang, and cold and fluids in the case of yin. These substantive factors are also subject to the pathological changes of excess and deficiency. Therefore, in the first part of this episode, we will look at the signs and symptoms of yang excess, yang deficiency, yin excess, and yin deficiency. Yang excess is essentially heat. Yang excess or heat can occur as an external pathogenic factor combined with external wind, or as an internal excess as the result of stagnation of qi, blood, phlegm, and or body fluids. The initial symptoms of external heat are fever and aversion to cold, which occurs simultaneously, slight achiness in the body, slight sweating, thirst, a floating rapid pulse, a red-tipped tongue, and a thin yellow tongue coat. As the heat moves deeper into the body, the fever becomes more intense, and other signs and symptoms appear. This progression is described in detail in the Wenbing, which is part of Shanghanlun Wenbing diagnosis. This subject will not be discussed in this series. However, if you are interested in learning more about it, I will be happy to supply my notes. Please contact me at joel@americandragon.com. The main symptoms of internal excess heat are fever, thirst, a red face, red eyes, constipation, dark scanty urine, a rapid full pulse, a red tongue, and a yellow tongue coat. These are the general symptoms, but there are many others depending on which organ is affected. This will be studied in detail in Zong Fu diagnosis. It is not required that every symptom be present to diagnose a condition. Fever especially is not always present in internal excess heat. Yin excess has 3 basic physical presentations: cold, dampness, and phlegm. Yin excess, manifesting as cold, can occur as an external pathogenic factor combined with external wind, or as an internal excess. Internal excess cold comes from direct invasion of cold into the interior, particularly the stomach, as a result of too many cold foods and drinks. The initial symptoms of external cold are a slight or no fever with more severe chills or aversion to cold occurring simultaneously, severe body aches, a more severe stiff neck, chilliness or shivering, no sweat, also called anhidrosis, no thirst, a floating tight pulse, a normal tongue color, and a thin white tongue coat. As the cold moves deeper into the body, other signs and symptoms appear. This progression is described in detail in the Shanghanlun, which is also part of Shanghanlun Wenbing diagnosis. Again, this subject will not be discussed in this series. However, as I mentioned before, if you are interested in learning more about it, I will be happy to supply my notes. So again, please contact me at joel@americandragon.com. The main symptoms of internal excess cold are chilliness, cold limbs, a lack of thirst, a pale face, abdominal pain made worse with pressure, a desire to drink warm liquids, loose stools, clear, abundant urination, anything that is white or pale, anything that is concave as opposed to convex, bluish lips, fingers, or toes, a bluish-purple tongue or a pale tongue, a white tongue coat, and a deep, full, tight pulse. Again, these are general signs and symptoms, and as with heat, there are many others depending on which organ is affected. This will also be studied in detail in Zongfu diagnosis. External wind dampness is the primary cause of arthritic conditions and is called B syndrome or painful obstruction. This condition will also not be discussed in this series. However, there is an extensive presentation of it on AmericanDragon.com. Go to www.americandragon.com/conditions/painfulobstruction.html. Internal yin excess manifests as dampness or phlegm and occurs as a result of spleen qi deficiency, which compromises the spleen's ability to transform and transport body fluids. The signs and symptoms of internal excess dampness are heaviness in the body, fatigue, heaviness in the head or limbs, fullness and stuffiness of the chest or epigastrium, a foggy feeling in the head, cloudy urine, vaginal discharges, thick exudate from skin lesions, a sticky taste in the mouth, a sticky tongue coat, and a slippery pulse. Dampness and phlegm are similar in nature. Phlegm, however, is thicker than dampness and is more prone to stagnation. The signs and symptoms of phlegm stagnation are a heavy sensation in the head, dizziness, mental problems, sometimes mental retardation, fat, plaque both in the vessels and on the teeth, stones, and lumps and masses. Now we will look at pathologies associated with the vital substance qi. Qi pathologies are internal conditions and can manifest as deficiency or excess symptoms. The excess symptoms are generated by a deficiency or some type of blockage. The deficiency symptoms are caused by toxic emotions compromising the related organ or organs to perform their functions. Within the body, qi has certain specific functions. The first function of qi is transforming. Spleen qi transforms food into gu or food qi, which supplies energy to the body. Kidney qi transforms fluids. Bladder qi transforms urine. And heart qi transforms gu qi or food qi into blood. The second function of qi is transportation. Spleen qi transports gu or food qi to supply energy to the body. Lung qi transports fluids to the skin. It also transports qi downwards. Kidney qi transports qi upwards, and liver qi transports qi in all directions. The third function of qi is holding. Spleen qi holds blood in the vessels and holds the organs in place. Kidney qi and bladder qi hold the urine. Lung qi holds sweat. The fourth function of qi is raising. Spleen qi raises the organs and, as was previously mentioned, holds them in place. Kidney qi rises upwards. The fifth function of qi is protecting. Lung qi protects the body from external pathogenic factors in the form of wei, or defensive qi. The sixth and last function of qi is warming. Spleen and kidney yang qi warm the body. We can expect then that qi pathologies will relate to their 6 functions. Qi stagnation signs and symptoms are as follows. Feeling of distension affecting the hypochondrium, the epigastrium, the abdomen, and or the throat. Distending pain that moves from place to place. Abdominal masses that appear and disappear. Depression, irritability, gloominess, frequent mood swings, frequent sighing, a wiry pulse, and a slightly dark tongue with dark edges. Qi deficiency can affect the lungs, spleen, kidneys, and heart. Qi deficiency signs and symptoms are as follows. Shortness of breath, or breathlessness, which is a sign of lung Qi deficiency. A weak voice, also a sign of lung Qi deficiency. Spontaneous sweating, again a sign of lung Qi deficiency. Fatigue, which is a sign of both lung and spleen Qi deficiency. Anorexia, or poor appetite, which is a sign of spleen Qi deficiency. And loose stools, also a sign of spleen Qi deficiency. Frequent urination is a sign of kidney Qi deficiency. And palpitations are a sign of heart Qi deficiency. In all Qi deficiency syndromes, the tongue is pale, the coat is white, and the pulse is empty. It is very important that you memorize these signs and symptoms if you intend to diagnose yourself or others. Without this information in your head, it will be impossible to know what's going on. Okay, well that's going to do it for this episode. If you have any questions or would like to order Shanghan Lun Wending Notes, which are available for $25, please contact me at joel@americandragon.com. Also, Zongfu Syndrome's Differential Diagnosis and Treatment is now available in PDF format for $35. To order, please use the previously mentioned email address. In the next episode, we will examine the pathologies associated with blood, Jing, and body fluids. I'll see you then.